Welcome to Prime Life. We call it Retirement 2.0. Leave each episode with tips and new ideas to help you navigate retirement in our new age. It's your time. Make it count.
This podcast is for educational purposes only. It is not intended as medical, investment, or financial advice. We do not sponsor or endorse any of the individuals, companies, products, or services featured on this podcast. Any statements or opinions expressed are of the individual who makes them. We hope you enjoy the episode.
Hello, everyone, and excited to be here for another episode of the Prime Life podcast with my co-host, Mary. Mary, how you doing today?
Well, I'm doing great. The sun is wonderful. It's just getting brighter and brighter. So, of course, it makes everything better. Thank you for asking, Joseph. How are you doing?
We're recording this and spring is just around the corner. So
it is. It really is. How are you doing, though?
I am great. Doing great. I'm excited for our episode today. So why don't we jump right in and get a little intro?
Absolutely. Thank you, Joseph. It's my pleasure to introduce Samantha Hainer. She's a registered nurse, a patient advocate, and a certified care manager. She's also the founder of Maledro Health Concierge. She helps adults and their families understand their healthcare picture and all the options. She partners with them to develop a process to ensure everything is handled in the right order at the right time. Samantha, welcome to the Prime Life podcast. Please tell us a little bit about yourself and what you're up to these days.
Thanks, Mary and Joseph. So I started out in the pharmaceutical world and moved into nursing, where I was an intensive care nurse for many, many years, moved into a management position where I helped manage an ICU and a med-surg unit. Throughout that process, professionally, I was in touch with patients in many different facets and realized the lack of support that many patients had. You know, the healthcare system is amazing. We do amazing things for patients. However, I like to describe it as there's so many good people in the system, but it's a broken system in many ways. And so patients would come back into the hospital with similar issues that should have or could have been resolved at home. And it seemed like there was no support system out there. You know, families do the best they can, but it always felt like there was something else that was needed. I moved outside of the hospital into a care management role, and that was when I was introduced to care management. And I loved it. I ended up opening my own business, and I'm the founder of Maledro Health Concierge because I wanted to be able to offer an even more comprehensive service, because I feel like this is where we are in healthcare. Families need support, and care managers are truly the answer to that picture because they can touch patients across so many different places in their healthcare journey. And so that's where I am today. I'm running my business, and I'm growing my business, and I'm learning as I go.
Awesome. And appreciate the hard work that goes into working in the hospital. It's not easy. So maybe we could take it a step back and define what case management actually is, and, you know, in practical terms, and why it might be more relevant to aging adults.
So you brought up something very important in what you said. You said case management. So case management and care management are very different. So case management, most people know about, right? So it's actually a good thing you mentioned that, because that's where we should start, right? What is it that we know in the healthcare system? And then how does care management relate to that or differ? So case management, you often run into at the hospital, at a rehab. Those are social workers, could be nurses, who have specialized training in helping you through the discharge process in that facility. Most people run into them at hospitals. They cover the insurance claims and all of that, help navigate that, help find facilities for families. But they're very limited because they deal with a lot of patients and they're not able to devote as much time to families and their individual specific situations. So that's where care managers come in. So care management, I describe many different ways. It's akin to having a professional family member. It's similar to having your own case manager, but we typically come with different backgrounds. You could be a registered nurse, you could be a social worker, a master's educated gerontologist. I've even met a doctor who became a care manager as well. So we have many different backgrounds. The value of what we offer, different from anybody else, especially case managers, doctors, is we can follow you across your continuum of healthcare. So care managers, I meet my patients in the hospital. If they go into the ER, I go in with them. Maybe they're just to be a sounding board. It could be there to advocate because they're not getting the care that they feel like they need. And then I can also make sure that that information from the hospital stay translates to the rehab. Oftentimes things are missed in the transition, and that's where care management shines. Is the medical community talks a lot about the continuity of care, and that truly is so valuable and important in your healthcare story and how well you come out of a healthcare crisis. And a lot of the errors, I think they say upwards of like 80% of errors happen in those transition points. So care managers, I find out what your discharge plan is. Being a registered nurse, I want to know all your medications. I want to know any caveats there. And then when I go to the rehab, I meet you there the same day. I make sure that they have the same medications. And then the following day, I make sure that they're all implemented appropriately because I realize that they have a certain period of time where the primary care at the facility actually comes and sees you. So I follow it through. So care management, I say, is truly that continuity of care. Because after the rehab, I make sure that your physicians have that same information, right? If there's any caveats, I make sure that everybody understands if one medication is stopped, the other one has to be discontinued as well. And so it's continuing that narrative in the most effective way for families.
Samantha, what are some of the signs that an individual or a family member may need your services?
That's a good question. Families come to me with many different situations. Some of them, typically it starts with your loved one having a health crisis. I would love it if people came to us to pre-plan and to get their healthcare plan in order ahead of a crisis, but typically crisis spurs action. And so families will reach out to care managers in crisis. It could be a hospitalization that's just occurring, or it could be they're in the hospital, they're trying to discharge my loved one. I don't feel like they're ready to be discharged, but I don't know what to do. Right? It's usually that when you run into that moment where you say, I don't know what to do, I need help. Right? It has, and I've had so many families come, well, I'm educated. I know how, I get you're educated, but we do this. It's like you go to a mechanic and you go to them because they do this every day, right? To figure out what's going on with your car. You go to a financial, um, a financial specialist for the same reason. You go to a lawyer for the same reason. And so that's where care management comes in, because we look at the entire picture to make sure that nothing's being missed. And so it's usually the common signs are you're stuck in a spot in the middle of a crisis and you're feeling like, I feel like I need more help. I don't know what to do. I don't know how to make these decisions that they're expecting me to make so quickly. Another thing that drives needing that type of assistance is your bandwidth, right? A lot of sandwich generation families taking care of younger kids, helping support their parents. They're just stretched beyond their actual physical ability to be present, right? So a care manager can go into the hospital with a HIPAA form, say, I'm an extension of the family, and then we can all bounce back and forth and support each other in making sure that there's coverage at the hospital to talk to the doctors. The other thing that usually spurs people reaching out is the holidays, right? Let's say for those that celebrate Thanksgiving and Christmas, those two back to back often spur a lot of research because you have two touch points with your loved one where you start to spend a lot more time with them and you start to notice that the coping mechanisms that they had that made you feel like they were okay, now that you've been with them for a larger period of time, you start to realize, you start to see the cracks, and that usually spurs change.
So you mentioned backgrounds of folks who work in care management. Gotta get that one right now for the rest of this conversation. What should a family member look for when they're talking to care managers? Either, because there's such a wide variety of backgrounds. Are there questions they should ask? Are there different best matches, right? Like maybe you mentioned the doctor as a care manager. Maybe that's for certain situations and not others. Maybe just help our listeners understand what to look for if this is something that they think they need.
And we'll get that answer after a brief word from our commercial sponsors.
NASA is always working harder to be your carrier of choice. We offer insurance products that can help you meet your retirement goals, such as protecting your savings, securing lifetime income, or paying for healthcare costs. We're dedicated to providing best-in-class service and are keeping things simple, and we'll have your back. We have around 400,000 policyholders and contract holders and have been doing this for a long time, 170 years, but we remain humble enough to always try to improve. For more information, visit nfg.com. Nassau Insurance products are issued by Nassau Life and Annuity Company of Hartford, Connecticut, Nassau Life Insurance Company, East Greenbush, New York, or Nassau Life Insurance Company of Kansas, Overland Park, Kansas. Subsidiaries of Nassau Financial Group. Products are not available in all areas. Policyholder counts are for all Nassau companies as of September 30th, 2022, and are subject to change.
Yeah, it's a really good question. I always recommend that people interview 2 to 3 care managers because we're all different, right? As you said, we all come from different backgrounds. I like to say the differentiator for myself is being a registered nurse. So I have that background. So my strength in understanding the medications, the care process in the hospital, what the day in the life of a nurse is like at the hospital, right? Because part of what I do with families too is level set expectations, right? What is realistic to expect of the staff? What is it realistic to expect of the doctors? What are the processes? So if your loved one is in a medical facility, it might benefit you to have a registered nurse. However, I say that on one hand, but we're all created differently, right? I know many care managers who are social workers who are just as knowledgeable because they put in the time, the energy, they spent the time in that space. And so it's really in the interview process. I always recommend to my families to have a set of questions and ask each care manager that question. And really it comes down to, at the end of the day, is it a personality match? Right? Is this person able to help me feel comfortable? Because when families come to us, someone is in crisis. Typically, someone holds a lot of fear, right? Can this person be supportive to me? Because we're supporting all family members in this process, right? We have a client who we're serving, but we're also helping support the caregivers in that picture. And so a lot of it does come down to personality. So you can go out to the aginglifecareassociation.org website and right on the front, find a care manager in your area. And I recommend you call a few of them and do those same questions to do apples to apples comparison.
Samantha, can you share a real life example of someone that you've helped either with the transition or that you've helped prevent a mishap of some kind?
Different stories, so you see the differences in how we do and can show up. A family called me, their loved one, the person who called me was the son. The mother ended up in the hospital unexpectedly. She had a cold, but then the next day ended up in the ER. She ended up needing to be intubated. So she needed mechanical respiration to go on. And as they were talking, again, I don't know this individual's health history. So I'm there listening, taking it all in. And they're unsure why she's there, why she's this sick. She's otherwise, outside of having diabetes, a really a healthy, well-adapted individual. She has a strong support circle. She's just really a strong person. So what's going on here? And I heard that she was a do not resuscitate. And in my head, I thought, as a nurse, I'm thinking, well, they don't know what's going on, but could be a very recoverable situation given that outside of this moment, she has a very strong health background and she's very adherent to what doctors say. So that if a doctor has given her direction, she's followed them. So to me, that means, okay, this person is going to adapt well. She most likely could come out of this if this is not a serious situation. So the do not resuscitate sat with me. And then after a day or two, as she was settling in, she was slowly starting to get a little bit better. It was weighing on me. Now, as care managers, we don't make health decisions. I think that's very important to say because I think a lot of my colleagues will agree with this. We're here to be your navigator, kind of like a Sherpa of sorts through the system. But I'm not here to make your decisions. I'm going to be here to be a sounding board. I'm going to bring my questions and concerns to you, but ultimately it's your decision. So I went to the husband and the son and I said, this has been weighing on me. This DNR status, do not resuscitate. I feel like she has a full life ahead of her. She's slowly starting to recover. I just feel like we need to reconsider that, and there were reasons she chose that for herself, but at 65, I mean, she still had a long life and she had a robust family who loved her, who was very involved. So there was no reason to risk that. And it was important to me to say it to the husband. We talked to the medical staff there. The medical staff thanked me and actually said, I'm so glad you brought this to our attention. We were wondering why she was a do not resuscitate status, talked about it. And I told him, if the situation changes, you can always change it back. And I think that's the important thing is having somebody by your side that explains to you how this process works and why we might be changing what his wife had said were her wishes, right? Because I take that very seriously that she had set this for herself. But she set it for a long-term chronic issue that's irreversible. That's why she didn't want to be resuscitated if that ever came. But this was a different situation. The husband decided that night to change her code status to full code. The next morning, we get a call. She had coded twice. And so they were able to save her life. They, completed CPR on her twice, were able to bring her back. And because of that, the husband looked at me and he said, gosh, she'd be dead right now. And I said, yeah. And we rode quietly all the way to the hospital together to go check up on her. But that moment, the DNR status was not the key critical thing here in the picture, right? But to me and to other care managers, we look at the full picture, right? We try to anticipate what could be a hiccup in your story, what could cause issue in your life, right? So that's a pretty dramatic story. She's alive and well now, and so she had a full recovery. In her story, I'd like to also add that as she was getting better, they still didn't have an answer why she was there. And so I advocated very strongly for her to get the specialists in to look at her situation because she was having a very uncommon presentation of DKA. This was years ago. And so she ended up determining, we got an endocrinologist on board. Within 30 minutes, he knew exactly why she had this issue. She was on the wrong medication. But had I not educated the family and fought for them to bring in a specialist, as long as she's getting better, they're going to discharge her, right? But I wanted to know why. And I thought the families needed to know why. And she was so adherent that I think she would want to know why. So we found out why for her, got her off that medication, and she's living a healthy life. A shorter story, and maybe something that's, maybe possibly more relatable to everybody out there, is medication errors. One of my clients is taking one of the new diabetic medications. They have very strict titration orders. You have to go up a certain number of milligrams every few weeks. And My patient was having other issues, which is why he asked me to be his care manager. He also didn't have any other family to advocate for him. So he knew that he needed to have a next of kin, if you will. And so in that process of working with him and being very vigilant about what medication he's on, what doses he's on, he called into his doctor's office, said, "Hey, I've finished this prescription. I need the next dose." So he was at 2.5. He was supposed to go up to 5, and the doctor ordered him 10 milligrams. So he accelerated him way too quickly. We happened to talk, and I mentioned to him, that's the wrong dose. Do not pick up that dose. Call your doctor back. And so we caught an error before he took it. And I know one other client who was in that situation, and it caused him kidney failure. So there is a really serious issue with getting the prescription wrong, right? And the doctor said he apologized. He overlooked the dose. He thought he was on a higher dose already. But we made sure together that he didn't get that dose. And I followed it all the way through. I called the pharmacist. I let them know what happened. I made sure they knew which prescription to fill, because my concern was, and I've seen this happen before, is that they still end up filling the wrong script. Right. So I told him from now on, check with me. We're going to double check. And that's what we did. So we prevented a possible serious crisis for him.
I'm sure you have thousands of stories to, similar and in great detail. Those are very interesting. You mentioned something before and something just now that in my mind connected. So you mentioned in the hospitals, you'll set expectations for families of what to expect in the hospital. And you were just talking about DNRs and that you don't make decisions, you provide guidance and offer suggestions, I guess. What should a family's expectations be of someone like you? Like, should they expect you to be there at every doctor or every hospital visit? Is it a certain amount of time? What is those expectations for the patient with the care manager?
Joseph, that's an excellent question. So again, this comes in when you're preparing for your interviews for your care managers. What I describe to my families is my process is very fluid. We start with a long conversation. I meet all of the important decision makers. That'll be the client, and then anybody else who's part of the decision-making process. And then I find out what their concerns, challenges, and issues are, what their goals are, right? What is it they're hoping to get out of this? And then I do my own full assessment, right? We look at social, psychological, their medical history. I even ask for past medical so I can see where the client came from, so I understand a broader, fuller picture. And then we set what our relationship is going to look like at that point. So for some families, it's, hey, let's touch base. Every time there's a doctor's appointment, we're going to figure out who should go to this one, right? For some families, I may just be a backup. If they're going to go to a medical appointment, all of a sudden something comes up, they'll reach out to me and say, hey, Sam, can you go instead? I try to make every effort to be there for my clients. So I set my client load at a certain number so that I can be as available to my families as possible, knowing the level of involvement that they want me to be at, right? I have some families who don't want me at the hospital, but want to be able to call me when they are there. They'll put me on speakerphone. I'll introduce myself to the doctors, and then I'll help advocate or question from that perspective. I have other families who want me there in the hospital with them. So I like to make it as flexible as possible where I can. I do have certain requirements that if you're in the hospital, I require that I see the person upon discharge. So there are certain things that I say, these are the things that I need to do to make sure that I'm following your loved one as closely and appropriately as possible. But outside that, it is very fluid. I have other families who call me for literally everything. So I talk to a family member every day. So it's really an individualized process and partnership. And then I have other clients where we just touch base every 2 to 3 months. It's kind of like a safety net program. They want somebody available if and when they go out of town for their mother. And so I'm there for that, right? I make sure I'm familiar enough with her case, with her medical history. She knows me well enough So when her kids go out of town, I check in on her every day. And so we have that process all mapped out. So it really varies based on the needs that you come with.
So it sounds like you customize and personalize with each client and their families, which is really wonderful that you meet people where they are. What can you share in terms of what are a few key takeaways that you can impart to our audience? Maybe something in the short term, maybe something in the long term, perhaps so individuals may think a little bit ahead about contacting someone like you versus contacting you when they are in crisis mode.
Yeah, thank you, Mary. That is a great question. So one thing I always educate my families about is making sure you have your necessary legal documents in place, or that your loved one does, and you as well. I tell people, when you're working with me, take what we're learning together and apply it to your own life, right? So make sure your loved one who's in the health crisis or has declining health has a healthcare power of attorney, a financial power of attorney, that they have a living will, that you know what their living will states, what the parameters are in there, and make sure that there's a financial power of attorney. Make sure that all of those documents are in place, and make sure the people who are assigned to each of those roles know that they're in those roles, and make sure they have a copy of the most current document. And make sure in your house you have a very easy to locate, but not totally out in the open, place to safely keep all of those documents if that's needed. So that's really the short term. Make sure you have those documents. Make sure, for instance, even for the financial power of attorney, that you start to begin that process of understanding where your loved one's finances are, what all their logins are. Each financial institution has their own release of information form. Make sure that on top of the legal financial power of attorney, but that you also go to each institution and make sure that they're aware that at some point you may need to call in and start to act on their behalf. So that's the short term. The long term kind of is an extension of that. Take those questions and that time that you're spending getting those legal documents in order to then start the larger picture planning. Because most everybody I know says, I want to age in my home. And that's really what a lot of us want to do. We want to help you age in place. However, to do that, there actually needs to be a logical plan in place on how that's going to happen, right? Do you have the finances to support that? Here's approximately what it might cost to do that. Can you start working with a financial planner now to make sure that you have the funds necessary, right? That's the longer term planning. Don't just say, I want to age in my house. Don't just let the months go by while you're healthy and well and your schedule is empty, because crisis happens at the most inopportune time, right? It's when our kids are sick, our job's blowing up over here, and then we have limited mental, physical, emotional capability to handle a situation. Now you're trying to find a care manager. Now you're trying to get them up to speed. So the long term is really starting to have those conversations, building that decision-making hierarchy and capability in your family, and making sure that your family unit knows how that process is going to go, because that will serve you well. And it will greatly reduce the stress that you incur so that you can be present for your loved one during their crisis rather than running around like a chicken with your head cut off.
Chicken with the head cut off is always a good situation to be in when you have a medical emergency. We're getting close to the end of our time here. So before Mary asks our final question of the show, that you shared a lot of very practical information, a lot of tips that people should be aware of. If someone wants to get in touch with you, what's the best way for them to do that? And we have all your contact info. We'll put that in the show notes, but just for people listening, what's the best way?
Is to go to my website, www.maledrohealth.com. My phone number's there, my email's there. If you have questions, I'm located in Pennsylvania. I can always be a sounding board, but that's really the best way to reach out to me.
Excellent.
Samantha, you're a registered nurse. You're certified as a care manager. You could do anything you want to do. Why do you wake up every day and do what you do?
It comes from it's just a deep passion. When I found care management, it truly was the epitome of everything that I've done in my life. And it filled this deep passion. I've always loved helping people. But way before I was a nurse, I wanted to be a forensic psychologist, which is a criminal profiler. So it's that investigative, so this ticks all of those boxes. So that's from a professional standpoint. But in my personal world, way long ago, my kids started having health issues, and I felt like I was left dangling by the healthcare system. And I was in that moment that my families are in. So I deeply personally relate to their stories because I know how it felt not knowing. And I tell my clients, listen, I may not know everything, and I don't, but I'm going to do my best to find the answers for you with you so that you're not left by yourself, isolated, alone, and not knowing which direction to go. So that's really why I wake up every day, professionally and personally. This is truly my calling.
Well, your passion definitely comes out. So I appreciate all you do. And thank you for joining us today for the Prime Life podcast. Again, we'll put all your contact information in the show notes. Mary, as always, a great pleasure to spend time with you. To all of our listeners, thank you for listening. Thank you for sharing these episodes and telling your friends. Share feedback with us. We'd love to hear from you. And everyone, have a great day. See you next week on the Prime Life podcast.
Thank you, Joseph.
Bye.
Thank you, Samantha.
Take care. Thank you both.
Remember to subscribe to the Prime Life podcast anywhere you find podcasts. You can find all of our episodes, contact information, and more on our website, primelifepodcast.com. Stay connected with us. Follow us on LinkedIn, Instagram, Facebook, and TikTok.